Chapter 14, Cultural and Spiritual Aspects of Patient Care. These are the theory objectives for this section of the chapter. Okay, so all nurses are expected to provide care that agrees with the patient's cultural needs. So all of our care plans should be based on a person's unique cultural and spiritual needs. So when we talk about transcultural nursing basically recognizes cultural diversity and it's being sensitive to the cultural needs of the patient and their families. Okay, so what is culture? So Webster's dictionary defines culture as the customary beliefs, social forms, and material traits of a racial, religious, or social group. And so basically, it's a person's beliefs, their values, their assumptions about life. Um, it can also include their attitudes, their roles, such as, what does mom do? What does dad do? Or, what are their roles in the family, their behaviors, religious or spiritual practices. And so it's obvious that cultural influences a person's perceptions as well as the decisions that he or she might make. And so their healthcare perceptions and decisions are not excluded. So your culture can impact um, decisions you make about your healthcare as well. Everybody in the healthcare process, patients, family members, significant others, nurses, other healthcare team members, everybody brings their own cultural beliefs um, to each healthcare interaction. And so, as nurses, um, not only do we have to deal with our patients with different cultures, our coworkers will have different cultures as well. And so we have to be respectful and mindful of everybody's cultural differences and backgrounds, whether we agree with them or not. Because whether we're talking about the patient, their family, or even if we're talking about our coworkers, all it can impact the patient in various ways. So we have to be respectful of everybody's cultural backgrounds and beliefs. Okay, so culture is, um, it, you have four different features, distinguishing features when we talk about culture. So culture is learned and acquired in a social context. So you learn your culture is shared by a particular group. It's incorporated the person's identity, and culture is dynamic and changes under influences of shared experiences. So, um, if you have, it can change if you grow up one way, but then as you get older, you start to associate with different individuals and start to believe different things. So it could be shared by different experiences as well. There's lots of different subcultures when we talk about. So, for example, for example, culture is, say, we're all Americans, but then you can have separate subcultures when we talk about different subcultures. So a subculture can be based on your economic status, it could be based on your educational level, it could be you're entering nursing. Nursing has its own culture, so you're learning the culture of nursing as well. So there's lots of different subcultures that people may belong to. Let's talk about ethnicity and race, the difference between ethnicity and race. Ethnicity specifically describes a group of people who share common cultural and a common culture and background. So that's like Japanese, Germans, those share a common culture and background. Whereas race describes a group of people based on their physical characteristics, such as the color of their skin, is what is when we talk about race. So, like we said in the previous slide, a subculture is a smaller group within a culture. So, so these smaller groups have similar values in addition to the views of the main culture. So subcultures, like I said, they can be based on a lot of different things, such as a person's socioeconomic status, their education, their occupation, sexual orientation, even political beliefs. Can have a separate subculture. Like I said, nursing itself has is a subculture, and you're learning to integrate into the culture of nursing. People in poverty could have a subculture as well because of their shared beliefs and practices. Their focus is on day-to-day survival. Whereas, people with a higher economic status, they're not just trying to survive day to day. They may go out and spend, uh, spending $1,000 on a pair of shoes might not be anything, for them. And so that's a different culture based on your economic, social economic status. Okay, so spirituality is an abstract concept that is best defined individually for each person. Although there are a lot of variation in how spirituality is defined, most people would agree that it's a central theme that's interwoven into how individuals characterize the quality of their lives, as well as their response, their um, their life's purpose. And so it could also be a resource that they use to guide their daily living, to guide their interactions with other people, to promote feelings of like security, safeness, strength, hope. So basically, it's the essence of who a person is, and it can give a person hope. Um, you know, so like maybe your relationship to the physical and the non-physical world. So basically, like I said, the essence of who you are. And so it may guide you in your daily life and things like that. So for nurses and other members of the healthcare team to provide holistic care to patients, each member must acknowledge that spirituality is real and legitimate aspect uh, of the person's health, and so it should be a part of their plan of care as well. It should, our plan of care should be individualized based on, their spiritual beliefs or whatnot. Team members must also understand that spirituality and religion are not um, not one and the same. And so, religion is more accurately described as a formalized system of beliefs and rituals that might be shared by a group of people, ritual like prayer, something like that. So, religion may or may not be a part of a person's spiritual dimension. And asking a person about his or her religious preference um, is that will not adequately address the person's spiritual needs. Um, Also, keep in mind too, just because a person is of one religion doesn't mean that they necessarily believe everything that that religion believes. So you need to have a conversation with your patient. A couple of words you want to make sure you understand. Atheist. Atheist is a person who does not believe in God. And agnostic. Agnostic is a person who neither believes nor denies in the existence of God. Okay, so Christianity is the largest religion in um, in the world, and so it's divided basically in three main divisions: Roman Catholic, Eastern Orthodox, and Protestant faiths. And so they believe in eternal life, and when you die, you transition to a life with God. So prayer, reading the scripture, attending church are some of the major religious practices followed um, by Protestant individuals. Now, in your book, from pages 190 to um, 193, they go through several practices of each of the various religions and beliefs. So take a look at those. There's actually a table and then some other information that goes through some of the practices. So make sure you take a look at that. Okay, so here's some other terms and things you need to be aware of when we talk about cultural competence or whatnot. So nurses have to have cultural awareness and cultural sensitivity. Cultural awareness is to know a person's history or know about their culture and appreciate the way they express themselves via food, celebrations, or whatever it may be. And cultural sensitivity is basically being sensitive to those beliefs. So you're not disrespecting them because of their beliefs. You're not using offensive language. You respect how they communicate, how they dress, the things that they believe and do. And then cultural competence is basically you knowing yourself and being able to examine your own values and attitudes and beliefs and prejudices. So it's important for you as a nurse to understand your own values and beliefs because it's going to impact how you react to other individuals. And so you need to be able to make sure you put those beliefs in check and not try to impose those beliefs on somebody else or disrespect somebody else for their beliefs. So you need to understand your beliefs so that you can, communicate appropriately. Okay, here's some more terms you need to be aware of. And these are barriers to becoming culturally competent. So we don't want to do these things. But stereotyping is applying beliefs about a culture to an individual group. So, for example, if you say all elderly individuals can't drive, that's a stereotype, putting everybody into that same category. Um, Prejudice is that's an emotional manifestation of negative stereotypes. So you emotionally manifest those negative stereotypes. So say for instance, if you have a stereotype against on a group of individuals based on their religion or something like that, and you emotionally manifest those negative stereotypes. And then racism is a form of prejudice when people groups or even institutions exercise power against a group that's assumed to be inferior to them, that's being racist. Um, ethnocentrism. Ethnocentrism is the belief that your own culture determines the standard. So you believe your culture or your way of doing things is the best. Cultural imposition, that's trying to impose your own beliefs on another person or group. So we don't want to impose our own beliefs on somebody else. And then cultural conflict, that's a perceived threat when you don't understand someone's culture. And then cultural shock is feeling uncomfortable when you're trying to understand someone else's culture. So make sure you understand these terms. Okay, so some major areas that you might notice cultural differences: how people communicate, how they view time, their organization of the family, nutrition, death and dying, and health beliefs. And so when we talk about communicate and how people communicate, for example, when we talk about eye contact, like, we teach you when you're communicating, you should maintain eye contact with individuals. Well, in some cultures, eye contact can be a form of disrespect. And so we have to be cognizant of that if we're dealing with a culture that believes that that's disrespectful. Um, and so we're not going to, try to force them to do that. Also personal space. When we talk about different cultures, some cultures believe the 6 feet is the norm. That's how they, communicate. COVID or no COVID, 6 feet is how we, communicate. Well, as other cultures, they believe in being right in your face when they're communicating. So you got to be cognizant of that as well. Sometimes also nonverbal cues might be different. Whereas when you shake your head up and down, that means yes to you, right? But in a different culture, it could mean something different. So we got to be cognizant of these different communicating with different cultures and what things might mean. Also, if you have somebody that speaks a completely different language, you may need to have a medical interpreter available to you to communicate appropriately as well. When we talk about view of time, different cultures have different views of time. What punctuality means, sense of urgency, or whatnot. Um, for some cultures, you know, if you're supposed to be at work at 3, you get there at 3, then you're on time. Well, whereas other cultures may believe getting there 15 minutes early is considered being on time. So you got to be cognizant of that as well. Organization of family. So you have different type organizational families. It could be patriarchal, meaning the male is the head of the household. It could be matriarchal, meaning the female is the head of the household. Or it could be egalitarian, meaning um, it's equally shared. The head of the household is equally shared between the spouses, between the male and the female. So you have to be cognizant of that. In some cultures, you're not allowed to speak um, to the husband without the, I mean, to the wife without the husband being present. So you got to be cognizant of that. Nutritional differences in food, we have to be cognizant of that because different cultures have different beliefs about food and what they can and cannot eat and what should and should not be included on their tray. And so we have to think about those things as well and make sure we're including that in uh, their plan of care. How they view death and dying, it's important to understand, do they have any rituals when it comes to death, bereavement, um, you know, uh, are there rituals in preparing the body for burial? We as nurses may tend to, automatically, prepare, but does their culture believe that the family has to do it? If so, allow that to happen. How do they express grief culturally? So, all those things may be, their culture may impact, how they view those things. And then healthcare beliefs, different cultures have different beliefs about health, disease, illness. Um, some cultures might believe illness is a punishment or whatever. Um, so how do they believe it? Also, when we talk about health, some cultures believe when we talk about different cultures and religions, believe that you know you're not allowed to accept blood, or so what is it that what are their beliefs, and we need to make sure we're cognizant of that, and the entire healthcare team is aware of those beliefs as well. So just keep in mind, these different things and how people might express their culture. Okay, so there's also a table in there, table 14.3, that goes over some common cultural values, practices, and beliefs among different groups of individuals, such as your African Americans, your Asian Americans, Hispanic Americans, Europeans, so on and so forth. So take a look at that table as well. But when we're discussing certain diseases, some diseases are genetically inherited and are more prominent in certain backgrounds. So, for example, sickle cell anemia is more prominent in African and Mediterranean individuals. Hypertension and diabetes is more prominent among Hispanic and American Indian individuals. So, make sure, you keep those things in mind too when you're, caring for different individuals. So when we're caring for patients with different cultures and interventions, when we're interviewing a patient or educating the patient or whatnot, we may need a medical interpreter if they speak a different language, so that we make sure they understand what we're trying to say and we understand all their concerns or whatnot. Make sure they're able to express any concerns, any fears they have if they're in distress or whatnot as well. Um, you could use flashcards or phrase books that's in the patient's language to help communicate with the patient as well. Make sure their diet is uh, in line with their cultural preferences. If they need low sodium diet or if they need diabetic diet or whatever, it should still be in line with whatever their cultural preferences are. Make sure you involve the patient as well as their family. If they want their family involved, involve their family in developing any care plans or whatever. Be an advocate for your patient. Whether you believe in what they believe in or not, you should be advocating for your patient and what they want and their needs and desires. If they value prayer and meditation, allow time for that. Let them have their prayer time or their meditation time if that's something that they truly believe in. When considering a patient's cultural background, it's important to the answer is number four. Remember the uniqueness of the patient. So, by remembering the uniqueness of each patient, you're giving each patient the level of care she deserves. So, when you generalize, stereotype, or become biased, you're forgetting the uniqueness of your patient.